Hey there, this is a video to describe male enhancement. We have a lot of folks who call to ask about the procedure, and this is a video to describe what it is, how we do it, what the costs are there any complications, are there any risks, and what we do after the procedure so that we don't have issues. And so male enhancement, as it is done here at Dr. Andrews Plastic Surgery, is essentially increasing the size of the penis with filler. We use a filler called Bellafill, which has bovine collagen, but it also has another product that encourages your tissue or essentially stimulates your tissue to produce its own collagen. And because of that, it's unlike other fillers like hyaluronic acids that essentially will fill but then are broken down by these naturally occurring hyaluronidases. This is different in that we are encouraging your body to actually make collagen, and so the effect can last 5 years. I've actually heard from other folks who have had it done, and sometimes you can get it to last longer than 5 years because it's biostimulatory. So again, Bellafill is biostimulatory, and it can produce collagen that can last a fair amount of time. The way the procedure works is we bring you in, we shave the area a little bit, we put a topical local anesthetic on, and then we do a vas deferens block. Just like when you're having a vasectomy, we block the whole penis. We do inject a little bit into the penis as well, and then we use a cannula to inject the Bellafill. We do not use a needle. There's nothing wrong with using a needle, but when you use a needle, sometimes you can impale a vessel, and that can lead to some issues. We use a cannula, which makes it safe, so the filler actually comes out of the side of the cannula, and we keep the cannula moving for safety as well. We do put a little stitch in such that the Bellafill or filler does not leak out. And then you leave. We do ask you to refrain from extensive physical activity for a couple of days, and we ask you not to engage in intercourse for at least a week, sometimes two. There can be some soreness in the penis, which would make intercourse a little painful anyway. So patients ask how big we can make them. It's key to understand that we are using filler, and that filler can certainly increase the size of your penis. The more we inject, the larger we can make you. Now, we can inject in multiple sessions as well. And so, as mentioned earlier, if we inject and we overwhelm the capacity of your penis, of that areolar space, that yellow space on the image, then the pressure will be too high and the filler will leak out. As you can see from this diagram, we inject usually 8 to 15 cc's at any one session. You can see that 5 mLs is a decent amount, but it is not a tremendous amount. So it's important to have realistic expectations with respect to what can be achieved. But with multiple sessions, we can make you even larger. And so we will wait 1 to 3 months and then re-inject you. As mentioned earlier, I treated a patient who had 20 vials placed in his penis over multiple time points, and I actually injected 21, 22, and 23 in him, and his penis was very large. It had girth and length. So again, it's important to understand what's achievable with one procedure. So guys ask, does this work? Absolutely it works. We're injecting filler, and we're only going to make you bigger. As a matter of fact, we make you bigger that day. If you look at these before and afters, you can see immediately after the procedure, you're bigger. As a matter of fact, one of the ways that I gauge how much we inject is I take pictures, I show it to the patient, and I say, hey, are you happy? If you're not happy, let's inject more. But again, we're limited by how much space each individual man has in the penis, and that limits what we can do. But again, we can do another treatment a couple of months later. We, again, have some before and afters. We also have a video of us performing the procedure, so you can see exactly how it's done, and it takes some of the mystery out of the procedure. As quiet as it's kept, I actually had the procedure done. I have a number of procedures here in the office, and I like to have procedures done because it gives me insight into what the patient is experiencing. So I've had hair transplantation. I had something called a thermi-raise procedure. I had a myelevate procedure. I've had lasers and fillers and Botox and all those things. And it gives me a unique insight perspective into what my patients experience, and so I can talk to you about how the procedure is done, some of the downtime, some of the risks. The biggest risk of the procedure is lumpiness, and so we sometimes ask you to massage the areas. If there is some lumpiness, there are some things we can do. We can inject actually hyaluronic acid around some of the lumps, and if they really bug you, we can remove them. There is a small risk of injection in a blood vessel, and again, I use a cannula to help prevent that from happening. This does not affect your ability to ejaculate. It does not affect your ability to get an erection, and as a matter of fact, some people say it can stimulate things a little bit. And so if you'd like to learn more, please look at the before and afters. Please read our website. Look at the video that we posted, and we'd be happy to see you. And one nice thing we do here is that we can do consult and procedure the same day to make things more efficient for you. The way we charge is per syringe. If we use a 1.5 cc syringe, we charge $1,000 for that. If we use a 0.8 cc syringe, we charge $600 for that. And so you essentially can titrate and determine what your budget is and determine how large you would like your penis enhanced. If you have questions, please give us a call, 319-450-7619. Thanks so much.